All right, muscle strains at the hip. There can be a lot of muscle strains at the hip. We can start with the hip flexors. Hip flexors it can happen in soccer, it can happen in track and field, where you get pain when you lift your hip up like this. Oftentimes, if this goes diagnosed incorrectly, sometimes it is diagnosed incorrectly as a hip flexor strain when it's actually something deeper like a labral tear, which I'll cover later. So you can have strains of your hip flexors, strains of your quads, also common in sports that involve a lot of sprinting. Hamstring strains, which I'm very privy to. They're a pain in your butt. Literally, they can be low hamstring strains, they can be proximal hamstring strains right up underneath your butt. If you're younger, if you haven't hit puberty yet, and you have pain that's right up under your butt here, it could be hamstring pain, but that hamstring, it could be avulsing or pulling apart a portion of the bone there that hasn't closed yet because you're still growing and you haven't hit puberty yet. So it's actually pulling a part of the ischial tuberosity away from the pelvis. That can be diagnosed with x-ray, and that just needs a lot of rest until that area starts to heal. So quad strains, hamstring strains, hip flexor strains. Sometimes you can have glute medius tears or hip abductor tears. It hurts to kind of kick your leg out towards the side here. But there's a lot of muscles on the lower leg that can be strained. They all just need appropriate rest, and then they need to be properly strengthened over the course of a couple of visits, gradually progressing you towards more plyometrics, agilities, and sprinting again.